After 28 years in practice, here are the thyroid triggers I found in patients that didn't get well on thyroid meds alone. The first one are defects in what's called the sodium iodide symporter gene. The sodium iodide symporter takes iodine that is outside of your thyroid in the bloodstream and brings it into your thyroid gland so your thyroid could use that iodine to manufacture thyroid hormone. A certain percentage of the people, they have a problem in that, meaning genetically they can't take the iodine from the bloodstream and bring it into the thyroid and hold it there long enough so the thyroid can manufacture thyroid hormone. So this is very, very easy to check to see if this might be a root cause in your thyroid problem. What you want to have your doctor check is a gene called the SLC5A5 gene. This is the gene that's associated with problems with that symporter activity of bringing iodine from the bloodstream into the thyroid gland. So your doctor can easily check you for that, and the solution, if you have that, is even easier than getting tested for it. Number 2 are halogen toxicities. So halogens are chemicals that slow the absorption of iodine into the thyroid case, and in some cases can block it very significantly. If the thyroid gland doesn't have iodine, it can't make thyroid hormone. The 3 halogens that we look for are first bromine. Bromine has been used in many bakery goods, pastries, and breads, and is often on the label as brominated flour. So check that out. The next place you'll find it is in sodas. Especially citrus sodas contain BVO, which is brominated vegetable oil. So be careful of your citrus brand sodas. Hot tubs and spas often use bromine as a disinfectant, and some medications like sedatives and asthma medication may have bromine in them. So the next one is chlorine, and you get chlorine from chlorinated swimming pools, chlorinated water, and hot tubs. And the last halogen we look at is fluorine. You find fluorine in tap water, especially in the US. Certain parts of the country use fluorinated water. They actually add fluoride to their water, which in some cases has been shown to potentially low IQ, in addition to interfering with thyroid function. Fluorine is also found in non-organic produce. There are fluoride-based pesticides that they'll spray on the produce, toothpaste and mouthwash, of course. Teflon-coated cookware will have fluoride compounds like PTFEs. Those are those forever chemicals. And essentially, again, this fluorine is interfering with the absorption of iodine into the thyroid. So bromine, fluorine, and chlorine are the ones you want to look out for. Super easy to test for. What you want to do is what's called an 8-hour provocative iodine study. You can buy these online. Hakala is a great lab to do this particular study. Doctors Data also does one where you take usually a 50 milligram iodine tablet. You collect your urine over an 8-hour period, and if your tissues and thyroid, and sometimes in females breast, are loaded with fluorine, chlorine, and bromine, one of those 3, you're going to catch it in the urine, and removing it from your body for long term is actually a pretty easy thing to do. Now, Lyme disease is something I see especially in Hashimoto's cases. The reason why is the bacteria that causes Lyme's, called Borrelia burgdorferi, that particular bacteria has a certain protein in it. And that protein is similar to a protein that exists in your thyroid gland. And what happens in Lyme cases is the immune system starts attacking the Lyme bacteria, the Borrelia. And then as a result, the immune system starts to go, what other proteins look like this protein? The thyroid does. This process is called molecular mimicry, in that the immune system will actually start to think that your thyroid gland is the Borrelia bacteria and will then start to attack the thyroid, and this is how we get into cases like Hashimoto's. The lab you want to do for this is IGeneX. They probably have the best Lyme panel on the planet. Really, really solid. The next one's a heavy metal toxicity, particularly mercury. So what mercury does is it messes up an enzyme in the thyroid called thyroid peroxidase, or TPO. Thyroid peroxidase is an enzyme that takes iodine and the amino acid tyrosine and kind of like smushes them together and actually makes your thyroid hormone, like T4. So that thyroid peroxidase enzyme needs to function properly in order for you to manufacture thyroid hormone. Well, mercury actually inhibits the function of that enzyme, the thyroid peroxidase enzyme, and as a result, it becomes very difficult for your thyroid to manufacture thyroid hormone. Mercury can also increase what's called Th17 cell activity. Th17 are what are known as T helper cells. And if they get overstimulated by mercury, what ends up happening is it overstimulates the immune system. If your immune system becomes overstimulated and you're genetically predisposed to something like Hashimoto's, watch out, because that's one of the ways that mercury can actually get involved in Hashimoto's disease. In fact, animal and human studies have shown that mercury exposure increases the risk of autoimmune thyroid disease, particularly in genetically susceptible people. The best way to do this is get with a doctor who can prescribe things like DMSA or DMPS would be even better for mercury specifically. And what you want to do is you want to take a certain amount of this substance, DMPS, and then you want to collect your urine, usually over an 8 or sometimes 12 or sometimes even 24-hour period. And what the DMPS does, if there's any mercury bound to your thyroid or bound to your tissues, it will actually kick it out into your bloodstream and then you will urinate it out. Because mercury, although you can test it in hair, blood is not a real valid way unless you've had a recent immediate exposure. But the problem with mercury is it binds to your tissues and it gets real sticky and it doesn't want to come out. So it's good to take what's called a provocative agent like DMPS, which will kick the mercury out of your tissue into the bloodstream, and then you could actually find it in the urine and know, okay, there's a toxicity here. And then once you find it, there are different heavy metal protocols to chelate the mercury out of the body. A very overlooked cause or aggravator to thyroid disease are nitrates. Nitrates we find often in lunch meats and bacon, right? Things that we buy across the deli. And the problem with these nitrates is twofold. The first thing they do is they do block the absorption of iodine into the thyroid gland, similar to the halogens that we talked about previously, as well as mercury can do that. But in addition to that, they increase the oxidative stress in the thyroid itself. So they actually increase and contribute to thyroid inflammation. So if a person has a condition like Hashimoto's thyroiditis, which is an autoimmune disease where the body is attacking the thyroid gland and it's causing inflammation in it, well, nitrates increase the inflammation in the thyroid more, worsening the condition. So for someone like this, they don't even need to test if they have nitrates. Just definitely get them out of your body. There are labs out there in different companies that will test your nitrate levels and can do it very effectively through urine, but it's not always needed. Sometimes just getting nitrates out of your body and doing good healthy cleansing can be enough to get rid of the pesky nitrates. The next one is a big one. It's birth control that contains estrogen or female hormone replacement therapy that contains estrogen. The reason why this is such a problem is estrogen, especially synthetics taken orally, estrogen increases the amount of what's called thyroid binding globulin. The liver makes this protein, thyroid binding globulin, and essentially what it does is it binds to your thyroid hormone and it makes your thyroid hormone ineffective. So you could have normal lab levels. You could have normal levels of T3, normal levels of T4, but you will not have proper function. You'll have all the symptoms of hypothyroidism because the thyroid binding globulin will be bound to those hormones. So like your T4 will be in the normal reference range, but it's not doing anything. Your T3 is in the normal reference range, but it's not doing anything. It can't communicate to the cells effectively and efficiently because it's all bound up by this thyroid binding globulin. You know, it's kind of like when we moved our office from one location to another location. We needed movers to pick the things up and move them. Lord knows I wasn't doing. Imagine if those movers were bound up by somebody, right? Like someone was wrestling them and holding them and stopping them from doing their job. Well, that's what thyroid binding globulin does to thyroid hormone. It wouldn't have mattered if we had 50 movers on the site if all of those movers were wrestled down by some MMA madman and pinned to the ground. They're not going to be able to do their job. And that's what happens with elevated estrogen and thyroid binding globulin, which it's made in the liver. The other thing is estrogen can stimulate the immune system system and increase the production of what are called autoantibodies. Autoantibodies are antibodies made by the immune system that literally attack the body. They're the things that actually create the damage that's seen in autoimmune disease. That's why autoimmune disease in general is more common in women. Like Hashimoto's in women, you see about a 500% to 800% increase in Hashimoto's in women compared to men. Now, the interesting thing about that is women make about 500% to 1,000% more estrogen than men do. So, of course, you're going to see more autoimmunity in women, specifically Hashimoto's, because you have this excess estrogen floating around. Now, if you add to that synthetic estrogens or bioidentical estrogens or estrogens found in birth control, it doesn't matter the kind, you're going to enhance autoimmune activity. You're going to increase autoantibodies. You're going to increase Hashimoto's or the likelihood of developing Hashimoto's or potentially another autoimmune disease. This is why hormone replacement is controversial. And in my clinic, what I like to do is find the root cause and help the person heal their gland naturally so they can manufacture their own hormones instead of injecting them or having them take a bunch of synthetic or bioidentical type hormones. And the last one is elevated cortisol, as seen in stage 1 adrenal fatigue. When a person has increased inflammation in their body, and it could be increased inflammation from anything. It could be from a parasite, a yeast, a bacteria, a mold, a fungi. There could be some toxin in the person's body that's essentially increasing the inflammation, right? Like if you have a bacteria in your body that shouldn't be there, it's going to increase low-grade inflammation. Well, the most powerful or one of the most powerful anti-inflammatory hormones in your body is cortisol. So your adrenal glands will raise cortisol to help deal with that inflammation. The problem is elevated cortisol will interfere with the production of TSH, which is known as thyroid stimulating hormone. In addition to that, elevated cortisol will interfere with the conversion of T4 to T3. The reason why that's so important is T4 is not really very active. T3, very active. So we need to convert that inactive T4 into T3. 80% of it happens in the liver. But if the cortisol levels are too high, you're not going to get the correct conversion of T4 to T3, so you're going to develop these hypothyroid symptoms. This is a problem with the adrenal glands, but really the root cause of that problem is increased inflammation in the body. Some great tests that you can do for this are PCR DNA stool studies. PCR DNA stool study is great, stands for polymerase chain reaction stool study. This looks at the DNA of the microorganism over looking at the microorganism. And here's why I like them typically better. Well, I like to do both, but here's why I like them typically better. Old school analysis of stool was you take a stool sample and you look at it under a microscope, and it's like searching for a needle in a haystack. Hopefully you find something, but a lot of the times you don't. This is why back in the day, years ago, 25 years ago, when I first started doing stool studies in my clinic, we used to have to do like 4 samples of stool, and sometimes we would still miss the parasite or microorganism because it really is like searching for a needle in the haystack. But with a DNA test, we're looking for the DNA of the microorganism. The reason why that's easier is because the DNA is going to be there if the microorganism is there. You know, it's kind of like if you had a crime scene and you had a criminal break into a store and he stole a bunch of stuff, right? And a little bit of his hair fell on the floor and he wasn't wearing gloves. So some of the DNA from his hand was there and maybe some of his sweat dripped on the floor or he spit or whatever. Okay, you can collect that DNA and you can go, all right, this DNA belongs to John Doe. We know John Doe was here, definitely, without a question. So he was here. In the same respect, if you have a particular microorganism, like a parasite, and it's in your gut, but you can't find it in the stool, well, you're typically going to be able to find its DNA because the DNA is going to shed all over the place. So that's why I like these DNA stool studies, to see what the microorganism truly is that's creating the inflammation, that's driving the adrenals to overproduce cortisol and causing the thyroid gland to then malfunction or become underactive. Those are some of the main causes of thyroid problems that are not typically looked at. Cortisol, by the way, is very easy to look at. I like either a 24-hour urine study to check for total cortisol or a saliva study done 4 times throughout the course of the day. Dutch testing is also really good for assessing cortisol throughout the day. But those are the best ways to check that. Regardless, there's actually 42 different causes of thyroid problems, but those are some big ones ones that often go missed. So get with your doctor, get yourself checked out, and I hope you get to the bottom of it, because the truth is there's definitely a root cause to your thyroid problem. I promise. You just have to keep looking. Don't stop looking until you find it, because it is there. See you next time.